Hello, everybody. My name is Zenobia Harris, CEO for the Kent Chamber of Commerce. We'd like to welcome you to COVID-19, a conversation with Washington Retail Association. Today, we have VP of Operations and Retail Services, Rose Gunderson, who's going to talk about employee COVID health screening, accommodations, and leaves. This is great information for people bringing back their employees, and so we wanted to bring this to you live on Facebook, and the recording will also be sent out to our membership base. I also want to send a special thank you to South King Media, specifically I Love Kent, Scott and Teresa Schaefer for being our media sponsor for these conversations. With that being said, if you have any questions, you are welcome to put them into the chat there on Facebook, and we will make sure to get those questions over to Rose. With that being said, Rose, take it away.
Thank you, Zenobia, and thank you so much to everybody at the Kent Chamber of Commerce for your invitation and the partnership we have. In general, Washington Retail Association has a great partnership with every chamber around the state. We collaborate, we support each other because we're all about supporting the business to help you thrive. COVID has done a lot of disruptions, but due to the resilience of many small businesses and big businesses, we're back on track, slowly and gradually, with a little bit of disruptions, as we all know. My job at the Washington Retail Association is to really navigate, help our members navigate some of the regulations. My last job was the small business liaison at Labor and Industries. I work with many other agencies to specifically support that I get to do in my lifetime. I hope in the midst of all these, you have good connections with friends and people, whether it's virtually or in person. Do it carefully, safely, and keep yourself healthy mentally and physically and spiritually too. All right, I'm going to get started. The agenda today, we're going to focus on talking about what general employment disability discrimination laws are about, accommodations under COVID, how do you do health screening, some best practices and tips. And also the federal government has legislated these new COVID expanded sick leave and family leave. We'll go through the nuts and bolts of it. A disclaimer, I want to make sure you understand this is not a legal advice session. It's all information I have assembled from publications provided by relevant government agencies and maybe some other articles. Just that's the basis of my of this whole presentation. Disability accommodations. There are two sets of laws under the federal government. There's the American Disabilities Act. Our state has the Washington Law Against Discrimination. Covered employees under the federal government is 15 or more employees. For Washington state, if you have 8 or more employees, you are subject to the complying with the Washington Law Against Discrimination. I have provided links here on the in this presentation. I believe you'll get a copy of this. Is throughout the presentation, I would reference to mostly what you should know about COVID and the ADA. There's a Q&A. You will get to know how I reference it, and maybe if you'd like to do your own research, you can go to these publications as well. In general, a very small summary of the ADA is that it prohibits employers from requiring medical examinations of employees unless it's relevant to some situations, and also making disability-related inquiries. What is a disability-related inquiries? Is when you ask for a health diagnosis from an employee, like what is your temperature? If you're just saying, what's your symptom? Do you have a headache? Are you feeling nauseated? Those are just symptoms, so they're not disability-related inquiries. And when can you do disability-related inquiries or medical exam? When there's a conditional job offer, it's permissible if you ask for that kind of questions or exam from all employees from this in that same job category. During employment, you could ask for that kind of information if it's job related and it's consistent with your business necessity, or if your employee has asked for some kind of accommodation due to a disability, you can ask for evidence to also understand they actually have. Standard reasonable accommodation for covered types of disabilities, it's any type of change to assist job applicants even, for them to, also for workers to perform their job or enjoy the benefits and privileges of employment, like your cafeteria is accessible to them. That's a benefit or privilege. Undue hardship exemption is available if based on the size and type of business or location is too difficult or expensive. And another example is if you reduce if your worker, if you due to the accommodation, you have to reduce hours of your operations, and then you cannot find another qualified substitute, that may be a bona fide undue hardship exemption reason. So now we go to the pandemic situation. Under the current pandemic, COVID pandemic, employers may do this list of things. Send employees home with COVID symptoms, ask employees if they experience symptoms, take their temperature, require infection control practices, and wear PPE. And you can ask employees if they're taking time off, is it due to medical reasons? Because it's important for that they inform you in case of a positive test. You need to inform other employees. Delay start date or withdraw job offers even due to COVID. Require delayed return to work if they have traveled to a high-risk pandemic area. Require testing when they have symptoms according to the CDC. Now, employers may not do this during a pandemic. You may not ask employees if they have underlying conditions that make them high risk, but you can definitely encourage high-risk workers to initiate a conversation with you. You may not compel them to take the vaccine if it's available. You may encourage or even pay for the expense. If it's job related, right now there's no specific guidance on whether you could mandate that if it's job related. You may not compel antibody tests. That means whether they have already had the antibodies in them. High-risk workers, Governor Inslee issued a proclamation at least a couple of months ago to protect high-risk workers who are 60 years or older, or they have underlying conditions that make them high risk according to the CDC, such as pregnancy people or people with diabetes and a number of other conditions that it's available for you if you click on the link that I have embedded into this particular slide. Accommodations that you could offer, of course, is working away from people, alternative work assignments. Maybe if there's no accommodation available, use PTO, or they could even go on unemployment in our state. Permanent replacement of high-risk employees are not permissible. And if you have employees who have pre-COVID accommodations due to other situations, you need to continue to adjust accommodations if needed. Okay, now we're going to talk about health screening for COVID symptoms. We're going to touch on the legal requirements to screen, how to communicate, and make sure you do it in writing. What's the best policy screen options and best practices? How do you follow up when the employee fails the screening? Be sure to pay attention to the privacy right, and also an employer's right to mandate COVID testing. The article I have listed here is a reference I used on some of these tips and best practices. The legal requirement comes from L&I because every employer is to institute a program to prevent sick employees from entering the workplace. The L&I directive related to COVID is listed here for you to really review. That is the go-to that their inspectors use to review everything when it comes to COVID requirements. Every employer should have a designated COVID point person to interact with customers, employee screening and follow-up, and contact tracing as well. If for bigger business, of course, you can have more than one point person. Again, it's important to communicate to your employees about the screening policies in writing. It's also important to communicate that screening to third-party vendors or someone coming to your premises to do delivery if they're going to stay, for maybe even a few more. Just entering the premises, you should have them be screened. And the specific screening process you need to put in writing, and the passing benchmarks. Of course, it's easy to say, the temperature passing benchmark is this. Or if you also ask whether they've traveled to high-risk pandemic area, you need to constantly update what they are. And your compliance expectation and what will happen if they refuse to do the screening. Of course, you don't want to just kick them out or say you're not coming to work. It is important to have a conversation and also consider accommodation options. And let them know how you make sure that you keep the information in confidence, and also what to expect if they have a yes answer to yes, I have symptoms, and what you will do when they fail the test, the screening. Screening options, it's best to do it in writing. Maybe set up a questionnaire, do temperature check, and it may be good to encourage everyone to do some visual inspection or just watch for one another to see who may look like they may be sick, and encourage self-reporting as well. If you require workers to do the screening at home before they come to work, make sure they're compensated for it. At minimum, do it at the beginning of each shift. Yes, Zenobia?
Hi, I have a question, and this might be specific more for the smaller businesses. Is this process of asking of temperatures, asking about, symptoms, is that something that should be done at what level? Is that an HR question? Is that at the C-suite level? Is that anyone in the office can say, hey, you coughed, you feel sick? I mean, where does that lie?
Yeah, very, very good. So it depends on, the question needs to be this questionnaire starts with, it's issued by the COVID point safety person to do that. And you have that point person to do follow-up, but you also encourage, it's a teamwork. We all want to watch out for one another. Maybe someone is sick and they don't even realize it, and yet I notice it. Or I know in some places where the worker is hiding their symptoms by taking, Tylenol or something, and to suppress their temperature. And, I think, some people don't want to miss work. And so it's important that we do that kind of watching out for one another. And of course, as I do the presentation later, there are bona fide paid COVID leaves for these situations. So it's important to communicate that to the employees. Did I answer your question?
That does answer the question, yes.
Yeah, great. I'll continue. When it comes to questionnaire best practices, think about what your goals are. Are you just going to ask symptom-based questions? Are you going to ask whether they've been doing socializing that is beyond what is allowed according to the guidance from the safety guidance according to the governor's office? And at this point, I'm not sure if it's legit or legal for you to ask those questions. I don't have a for sure right answer for that, but you could, and we can maybe talk about a little bit more. And the question should be brief and ask for yes or no response, because if it's yes or no, it's not as much of a privacy question as much as, because it's just yes or no. Because you're only asking for symptoms, you're not asking for a diagnosis. If you're going to have them write down the temperature, then that is a confidential private information. And again, update those symptoms, because CDC guidance changes constantly. Temperature check best practices. Do it at the start of each shift. You can even have them do it at home. Observe employees, spot checks, encourage self-reporting, maintain social distance, and make sure everyone is wearing the PPE needed for the specific job they do. Guard privacy of results. Whether you log temperature results or not, it's not exactly necessary. Maybe yes or no is just sufficient. And if you save any of this information, make sure it's kept confidentially. Do not keep it with their personnel file. Keep a completely different file for this type of record. When they say yes to a response about having a high temperature, or yes, I feel nauseated and I have a fever or whatever, make sure you send them home, encourage consultation with healthcare provider, and get a test, as you know, because if you, without the test results, you wouldn't know whether they have other, there may be contamination at your work site. And sanitize the work areas right away as well. Communication expectation, to comply with the CDC guidance. Actually, as of today, CDC has another new guidance about how long they need to self-quarantine, and how soon they could come back. So stay updated. And what does return to work look like, and in what ways? So constantly stay in touch with all the resources and information. How do you communicate to other employees when someone is tested positive? Yes, we don't want to disclose the name, because it's a piece of confidential information. For a small business, it is their heart to keep that confidential. But it's best for the employer or the point person not to ever say the name. If the other employee says, is it so and so, whatever, you just don't even respond. They know. So and try to identify who may have been exposed. Look at their work schedule, time record, third-party logs, to see who may be around this particular employee that's tested positive. And think about your sanitizing practices. Is that person asymptomatic? If it's asymptomatic, then that's a lot harder to figure out who they, just do a lot of checking around. Right, and on this slide, it says 14-day quarantine period decision. Again, go back to the CDC. I've mentioned the privacy, and I think I pretty much mentioned that right now, there's no one set of law that protect employees' privacy. It's the ADA, it's the Washington Law Against Discrimination. People always refer to HIPAA, but HIPAA is applicable to healthcare providers and not employers. So, but in Washington state, there's a Washington data breach notification if the confidential information has been compromised. It may be subject to this. I'm not a lawyer, but in this RCW, it talk about health data, but is it consumer health data or employee health data? that's something to consult an attorney about whether that compromise is subject to this data breach law. Employers' right to require testing, yes, but it needs to be a good source, accurate, reliable. Antibody tests, no. And right now, it's not realistic to test every employee due to limited testing capacity. And the recommendation to do 2 testing before they come back is also not practical. So CDC has said, that might not be necessary, just for practical reason. Okay, I'll take a breath, and now we're going to go to the COVID federal expanded leaves. There are 2 categories. One is paid sick leave, one is family medical leave. Hi, Zenobia, do you have a question?
Yeah, we had some questions come over in the chat, and so I'm not sure how you want to do this because I haven't seen the presentation, so I don't know if you're going to go over these. Do you want me to ask this and you can say, well, we'll talk about that later on in the presentation?
Yeah.
Okay. So the first question is, what should employers do in regards to employees who refuse to wear face masks or follow other COVID-19 related regulations?
That is kind of outside of this. That is a follow-up thing, and just today I got some updates that is not published yet from LNI. There have been a lot of conversations about accommodations, or some have said, oh, wearing face shield is adequate, but LNI said, no, face shield itself does not have the engineering to really prevent all the aerosol from coming in, from being exposed to when, especially when they're within 6 feet of each other. And current policy is face shield is not sufficient. And if they refuse, it's best to just ask, do you have some medical conditions that justify this disability accommodation?
Okay.
So in the strict letter of the law, as I mentioned earlier, they need to give some kind of statement from a medical provider in order to justify the accommodation. Most people just say, I can't breathe, or I faint. And some employers are willing to accommodate just without it. And if they can provide them a way to work away from people that's always 6 feet from one another, or maybe take away some of the jobs if that really require them to, or minimize their need to be within 6 feet of other people. If it's only occasional, then they can go away. They still need to wear the face mask, but then they can endure it for maybe 2 minutes and go back to their isolated work condition. So today, a draft from LNI is gonna give some accommodation. I don't feel I could disclose that because it's not public, but just watch for it. Hopefully it will be public information soon.
Okay, thank you. I think most of these questions are probably L&I related. It's about refusal for either employees or customers, taking folks' word as far as living with a vulnerable person. And so I think some of these questions, are all work sites required to do temperature screenings. This may be a good opportunity for us to have someone from L&I come on, or from the health department come on and answer these questions.
Yeah. I would recommend Craig Blackwood. He's a great speaker, and I can give you the email.
Yeah.
But the covering FAQ that will soon be published addresses some of those, handling customers and the face shield compromise, that it's still adequate. So those are all good things. I'm really excited about what's coming.
Okay, good. Thank you. All right, so we'll hold off on those questions. And for the folks that did ask those questions, what we'll do here at the Chamber is get these questions out to folks that can answer them and give you a detailed answer, and then we'll try to get them out back to you as soon as possible. So thank you so much, Rose.
Yeah, and I also have written an article called The Escalation Face Covering Conversation with Customers. I will share with you as well.
Awesome. Yeah, you can drop it in the chat box and we can share it out with everyone too. Thank you.
Yeah. So with the expanded federal leaves, COVID leaves, this the box at the bottom of this slide, they are all links related to relevant information on all these leaves, and you can click on them and get answers. The basis of most of my presentation in subsequent slides are based on the questions and answer link. There are 74, 75 Q&A that I use as the information basis of my whole presentation. So I will, in my presentation, I actually reference to the specific question number, so you can go back to it if you want to. Who are the covered employers if they have less than 500 employees? And then there are employers with less than 50 employees may be exempt if business viability is a reason. So the Q&A questions there provides you the specific conditions of what those viability reasons are. You count both full-time and part-time employees for those who are in the US and US territories. You also count even day laborers, even those that are from employment agencies that are not really your employee, you don't hold their payroll record, you count them as well for this particular purpose. And you may be exempt from coverage if you are a healthcare provider, or these are healthcare workers or first responders. The definitions are in the Q&A questions I listed there. You do not have to apply with any government agencies to be exempt. You just have to read these questions to say, think about how you actually meet those, the specifics. And so that's, and another qualifying exemption is if the absence of these workers makes it impossible for you to operate at a minimum capacity, or it's a substantial risk to the viability of your business, is also possible for exemption. So the funding of the benefit is really the employer pays the wages, but they may claim credit via the payroll taxes offset and IRS refund. That means if the wages are going to be higher than the payroll tax that you pay, IRS will give you a refund. The wages include wages and health benefits, and you do not have to pay payroll tax liability on these leave wages. That's the link I provided for the tax credit to claim. However, if you are receiving the Paycheck Protection Program loan, you cannot claim the credit, but you're still subject to providing these kind of leaves to your employees. Employees' work history, in order to qualify the benefit for the sick leave, they have to have worked for you at least 80 hours. Actually, for sick leave that offer them 80 hours of sick leave, they do not have to have work history with you. Say if they start today and then they are tested positive today, they're qualified right away. For family leave, they have to have 30 calendar days of work history with you. The requirements for employer is to post a poster. There's an employer right poster, and post it in every building, send it and give it to them in person or via email, or somehow explain it to them and let them know. You're not required to provide it in the language required, but in the link that I provided, there are multiple languages available for that employer poster. You cannot require employee to find a replacement in order to use the benefit. You could, and also always they recommend really initiate through an agreement to between the employee and employer. They just really want that collaboration in the relationship to work out when it comes to giving these kind of leaves. Employers do not need to submit documentation, but they need to have these documentations in place for the name of employee, dates of leave, reason for the leave, a statement from the employee that they are requesting these leaves, and also if they're saying, I am subject to a quarantine because of a healthcare provider's request, or childcare and schools are closed, you need a document from these third parties in order to, as part of your documentation. The duration is limited. It's been effective since April 1st, and it's going to go through the end of this year. You can only have one paid sick leave during this duration. That means the 2 weeks available to one employee is the maximum is 2 weeks, whether you have several events or not. There are six authorized leaves is if there's a quarantine order by federal, state, or local government. Now, there's a lot of confusion on this particular authorized leave. When there's a stay-at-home order from the government, your business is still has to be open, and yet your worker is not, due to the quarantine order, they cannot work. That is what number one is. And then the self-quarantine advice by a healthcare provider, COVID symptoms, seeking a medical diagnosis. Just because you have COVID symptoms and you stay home does not qualify you for these paid leave unless you are actually getting a test. That's what it is. And you're caring for others who are in the number 2 and 3 condition. You're caring for someone who is in self-quarantine or caring for someone who is seeking a diagnosis. The definition of others is beyond children and parents. It's also for anyone who you have an expectation to care for. Say you have a roommate who has to self-quarantine, who have symptoms, and you have to care for them. That could qualify as well. If you're if you have COVID conditions, you're actually sick. And number 6 is caring for children due to school and childcare closure. For number 6, the family leave is only applicable to closure of school and place of childcare. Family member criteria, I touched on it a little bit. It's very similar to the Family Medical Leave Act. Exceptions I mentioned earlier, if you are in relationship with those with the expectation that you will care for them. Again, your neighbor, even if they have no one to care for them, your roommate. And also if you have a child with disability that is incapable of self-care, that is also a valid relationship. Expanded, what are the maximum benefit and waiting period? For the basic leave, there's no waiting period. The maximum benefit is 80 hours, or for a full-time employee, that's 2 weeks. The wages of pay varies between the reasons that I have of leave that I have listed earlier. If it's from 1 to 3, quarantine or seeking medical diagnosis or self-quarantine, they get 100% of their wages, but it's capped at $511 per day, or maximum of 2 weeks is $5,511. For reasons under 4 to 6, caring for others and you're actually sick with COVID, or caring for children due to closures of school and childcare, is capped at $200 per day. For expanded family leave, the maximum benefit is 10 weeks, there's a 2-week waiting period. You can apply the paid sick leave to qualify for the 2 weeks of waiting period. It's capped at, again, $200 a day and $10,000 maximum for the 10 weeks. So how do you calculate the benefit? And like the wage basis, you use the average work hours of the last 6 months, and you use the Fair Labor Standards Act calculation. So if the hour fluctuates, then you use the 6 months average hours, or if they haven't worked for 6 months, you use the initial agreed work hours. If there was no initial agreement, you use the average hours per day work history. You could also include the overtime pay as base pay. For instance, if it's a part-time worker, they're 1 week, they're expected to work 50 hours, you can pay them that whole 50 hours. What that means is that the following week, the maximum hours they can get for paid sick leave is just 30 because there's a cap. You do not have to pay them time and a half, even if it's overtime pay. And if their work hours is reduced, use work schedule history. You are also, employers are may choose to pay supplemental benefits if the cap, if there's a cap in pay, so you can pay them supplemental benefit using the PTO they have or any excess payment, but the excess payment you cannot claim tax credit. And if you use their PTO, you need to have a policy in place so that it doesn't sound random. Intermittent leave. Can you have intermittent leave using these COVID leaves? If you telework, yes. And as long as the employer-employee reach an agreement. If you're not teleworking, there's a concern about infection, because especially when you're being quarantined or when you're caring for someone in quarantine. But if you're just caring for children at home without symptoms or any situations at home, and the employer agrees to have you to take intermittent leave for that 2 weeks or for that 10 weeks, that would be allowed only for caring for children at home. So there are similarities with the FMLA, is the job restoration right exists, and with a few exceptions. If the position is eliminated due to economic and other operating conditions, or for highly compensated employees, or if you have less than 25 employees, there are some exceptions, and you can look at that Q&A number 43. Health benefit continuation, if you've already offering it, it will continue. But since there's no prior work history required, so some employees who are new, who are still on the health benefit waiting period, the waiting period should not, the accruing of the waiting period should not stop when they're receiving the benefit. Employees' right to dispute or file complaints, it's just the same process as the FMLA. Intersection with other types of leaves. I've mentioned, so the Federal Medical Leave Act, they have the right to access COVID leaves first for covered events, and then they may access other types of leave after exhausting the expanded COVID leaves. However, within a 12-month period, if they have used FMLA and they also use the expanded leave, the combined maximum they can use is 12 weeks of family leave. So this is referenced in the question 45. It's kind of, to myself, I was kind of confused reading this, but this is what I understand is, say if you use 5 weeks of expanded family leave, and then later on you have a reason to use the family medical leave, The maximum you can access, you can have leave within a 12-month period is 12 weeks. You cannot use COVID leaves concurrent with getting an employment benefit. If you're on workers' comp benefits, if you're getting time loss, you cannot use this leave. But if you're on light duty return to work, and you need to use this leave, yes, you can do it. You can access this leave, even though you're on this workers' comp return to work light duty or stay at work type of program. Employers PTO, you may use it concurrently, as I mentioned, to supplement the wage shortage. If you're on voluntary leave of absence, you can still access extended leave if you have the qualified event. But if you're on mandatory leave of absence, according to the employer's mandatory, whatever reason it is, you may not access the extended leave. So action items for employers after studying these expanded leaves, COVID expanded leaves, you need to create policies and documentations for implementation. Train your HR or payroll employees on eligibility and compensation. Make sure your managers understand what they are and work with their staff in communication. Or of course, you make sure you communicate with every employee and evaluate whether to claim the small business exemption. So that's something to consider if you're less than 50 employees. And constantly monitor other local and state action on leave laws related to COVID, because they may complement each other, they may conflict, and usually in our state, the type of policies most favorable to employee prevail. So a little advertising here. I have provided a number of links to our website. We have visit our reopening resource website, our COVID safety operational plan. We have a list of in-store posters that you can access in English and Spanish. So if you click on these three icons, wear a mask, there's a video to promotion on really encouraging face covering usage, and the video link in the middle just tells you about our program in supporting our members. We have several upcoming webinars about COVID, rebooting your business in COVID, how to access some inexpensive digital resources to reboot your business. So this is the end of my presentation, and I welcome you to contact me or ask any questions in the future. We are all here to support one another, just like the Kent Chamber. Thank you.
Awesome. Thank you so much, Rose, for that presentation. Really good information. We will be sharing out these slides to our members. We will host it on our website as well. This has been recorded, so if you know of anyone or business that is in need of this information, definitely send it out to them. Scott, were there any other questions in the chat?
No, I shared them all with you.
Okay, awesome. Thank you. Yeah, so the questions that were asked in the chat, a lot of them were so specific that I think it's most important that we get those to someone in L&I, directly to King County, to have those questions answered. But Rose, we appreciate you. We appreciate the work that you're doing, and whatever you feel like, sharing with us, we would be happy to have it. We would love to have someone come and speak to.
Yeah, and last but not least, I should have mentioned, Kent is a vital city. You guys have a lot of large corporations based there. You have a lot of small businesses. Kent is a thriving community, and I hope we all stay resilient.
Yeah. Yes, and we'll all do our part to assist with that. Yeah, we have about 4,000 businesses in the city of Kent, so there's a lot. Yeah, there's a lot going on, and so again, if you need assistance, that is what the chamber is here to do. So reach out to us, whether it's on our Facebook page or directly emailing us. or our Kent Chamber page. We are here to always assist businesses here in the city of Kent, really in South King County. So again, special thank you to South King Media, Scott Schaefer, for allowing us this opportunity to be live on his forum. And with that being said, have a wonderful rest of your day, and we'll talk soon.
Thank you.
Thank you. Bye-bye.